Hi, everyone. Thank you all so much for joining us here today. We're so excited to have you all here and to have our wonderful guest speaker, Virginia Hedrick, who joined us on her birthday. We're so lucky and blessed to have her involved with today. So we're going to dive right in and get started. As many of you should know, we're Redbud Resource Group. We're a nonprofit that focuses on changing health and education outcomes for Native peoples through inspiring allyship and working to fill things like these data gaps we're going to start discussing today. So my name is Madison Esposito. I am an enrolled member of the Berry Creek Rancheria of Maidu Indians of California. I'm also the Director of Research and Development here at Redbud. My background is in public health, biomedical research, and medicine, specifically within the context of Native communities. And our wonderful guest, we are so pleased to have Virginia Hedrick here with us today. Virginia is currently the Executive Director of the California Consortium for Urban Indian Health, also abbreviated to the phrase CICUI, and she serves on the California Wellness Foundation Board of Directors. She's an enrolled member of the Yurok tribe of California and is also of Karuk descent. She has more than 13 years of experience in public health. Her work includes chronic disease prevention, implementation and policy impacts of the Affordable Care Act for California tribes, as well as health research. Thank you so much for joining us here today, Virginia. I would love to start by hearing you talk a little bit more about what originally brought you to public health.
Yes, thank you. Really, it's an honor to join you today, Madison and Taylor and Redbud Resource Group. I'm really inspired by the work that you're doing and just happy to be here today. And when we were looking at dates, this seemed like a fun thing for me to do with you. So what brought me into public health, the real true story is I just started dating a man who lived in Sacramento, and the week before my finals, finishing my undergraduate degree in Los Angeles, he invited me to a bear dance in Susanville, and I was like, I can't go. Like I'm like literally the week before my finals, and he was like, oh, I just really would like you to go to the ceremony with me. And then I thought, what the heck? Like I'm almost done anyways, might as well go. So I go to this ceremony and I met a tribal epidemiologist there, another Maidu woman, who was like, you're graduating, you should apply for this job at the Tribal Epidemiology Center with the California Rural Indian Health Board. And I said, I don't really know anything about that. I'm not sure that I could do it. And she's like, oh, I know you could do it. Like based on everything you told me you've been doing an undergrad, I know you could do it, just apply. And so I always like recognize that space of like being in ceremony and being at the right place at the right time that can just change your whole life in the career that you enter in. And I got that job a couple weeks later and moved to Sacramento and worked to build what is now the California Tribal Epidemiology Center for almost a decade. So that's what brought me there, and it was a huge learning curve. But it was and has always been a really, really fun opportunity to do this work.
That's awesome. Thank you so much for sharing your story. Yeah, great. And so, as I mentioned before, Virginia is the executive director of the California Consortium of Urban Indian Health, which is a 501c3 nonprofit and statewide alliance of urban Indian health programs. They address things like substance abuse and community wellness reports and this data availability gap that we're going to be talking about today. SCUI blends the leadership and experience of their consortium members with shared resource development and compiles applied research with educational and policy advocacy efforts to innovate strategies for supporting the health and wellness needs of the urban Indian community here in California. In addition to the robust and in-depth community wellness reports published by SCUI, their research recently published a phenomenal report entitled A Data Profile on American Indians and Alaska Natives in California, which is described as examination of data sources that pertain to American Indian and Alaska Natives, their shortcomings and potential solutions to improve their usability by Native serving organizations, and is really the catalyst for this discussion. We'll be going more into detail about what this report reveals and about data gaps in sources pertaining to Native communities throughout this talk. But Virginia, could you take a second to tell us a little about what motivated SCUI to put this report together?
Yeah. First, I want to finish the first story that I shared. So that boyfriend is my husband, and we have 5 children that we're raising here in Sacramento. So the journey continues in other ways as well.
Amazing.
So what really motivated us to put this report together was these data gaps that are identified in the discussion that this report really covers is something that's really well known in American Indian research communities, right? So anyone who is looking at what are the health problems, and I think we all ask, like, any good academic will say, like, well, what is the problem? Like, where is the data? And so really the motivation behind it was, let's put this all in one report and let's lay it out in very simple terms so that anybody who wants to understand these issues, because we speak on from a policy, SCUI also does policy advocacy in terms of increasing funding resources and have done a lot of work over this pandemic, but you always need data to support your request. And so we felt like we're always citing these things and bringing them up in testimony, writing them in letters to Congress, writing them in letters to the state, that really putting it all out in a report where we could use it as a reference material. If you want to understand more about what we're saying, if you want to understand more about the limitations, please look at our report. We also submitted this to the state epidemiologic work group here in California, the SEW, where state epidemiologists meet on a regular basis, not just on specific American Indian data issues, but on data issues. And we really wanted that work group to understand, have a really full, clear picture of the limitations that were being brought to that table.
Great, yeah, and I'm glad that this is tying really well in together with the next slide that we have here. So I know that this is a mixed audience, and I don't know how familiar everyone is with data science, data analysis, and the importance of data. And from what Virginia just touched on, you can tell that there is a lot of importance to this data, but let's break it down a little bit further. So the way research works, right, is you get your data, and from that you can access funding with preliminary data sets, which can help you bring interventions into places that need help and need extra support. And then those interventions will lead to an impact in the community that can improve health, education, economic outcomes. But when you're missing from that data, the rest of this downflow completely disappears, and you're not able to get the support you need to make those interventions and get to that impact. And what happens is you have underreported disparities, and you have increased disparities because people don't actually understand that the problem even exists. So this is a chart I like to bring up a lot. This is death rates for heart disease that was published by the CDC. And as you can see here, Native people aren't even represented in this graph. And so when researchers go to come up with an intervention to focus their efforts into the places that need it most, they address data like this. And when Native people aren't in that data, we're not in those interventions and we're not receiving that impact. And so this is just something that really stood out to me while I was doing my master's degree. And it's something that really resonated right when I saw this report from SECUI. And so let's break down that report a little bit further. Oh, sorry, there's also this. So in addition to not getting those impacts, even the organizations that are focusing on these efforts receive half a percentage of charitable giving. So the financial support, the generous giving support isn't there either, because those people are also working off data sets that miss out on Native people. And in California, that rate drops to 0.1%. So there is a very dire need. And now let's break down what's in this report. So we have identified that the existence of these gaps in the data is devastating to the Native community and directly impedes our ability to gain access to resources and programming that we need. But let's break down why these gaps exist in the first place. What are the root causes of this erasure? In this SECUI report, there are 7 well-documented American Indian Alaska Native data capacity issues identified and discussed throughout the report. The first one is the issue of small or suppressed sample size. And for those of you that are less familiar with research, when the number of research participants that are actually in your study is too low, it can be difficult to make a conclusion about the data gathered from those participants. And so small sample sizes are usually omitted from the data set altogether. This is very frequently cited as the reason why Native people aren't in research data sets. The second is limited access to raw data by Native organizations and epicenters. This is a real barrier to these groups accessing the baseline data they need to fully design and implement their programs and interventions. Then there is the grouping of American Indian and Alaska Natives into other or multiple race categories. This is essentially when a person is listing their personal information. If they select AIAN in addition to other race ethnicity categories, they will likely be omitted from an AIAN data set, erasing their data from the set entirely. There's also the issue of racial misclassification, which is when a Native person is recorded as a different race or ethnicity. In fact, as stated in the SECUI report, between 30 to 60% of health conditions and causes of death for Native people are misclassified as non-Native in funding equations in public health policy discussions. That's a huge loss of data. The lack of verification of data in federal data warehouses by urban Indian health organization is also an issue, as these data can often be incorrect or misrepresentative of the Native community they're supposedly reporting on. There's also a lack of generalizability of local level program data to state and national urban Native populations. Finally, there is the issue of the variety of definitions of who is and is not considered Native, such as some data sets only including Native people from federally recognized tribes, while others will include anyone who self-identifies as Native. Now, Virginia, when I saw this figure, when I was going through this report, before we even talked, I was blown away from it. Anyone that knows me knows I love data representations, graphical representations. I love this image. I think it does such a great job of concisely and impactfully framing the issue of native erasure from data sets. And I would love to dive into it a bit further. So first, could you tell us a bit more about the process you use to identify and select these specific data capacity issues?
Yeah, so really it was based on experience with various databases here in California specifically. But as you well pointed out, these apply really nationally and in most states. Some of them are issues that happen more frequently in California than in other areas. So the issue of smaller suppressed sample size, I think that happens across the board. The issue of racial misclassification is something that has been studied here in California a number of times over on very specific topics. So birth and death, sexually transmitted infections, things like that. So it was really a mind mapping among tribal epidemiologists and those who have worked in the health arena here in California with the California Rural Indian Health Board and the California Consortium for Urban Indian Health, sort of writing out what are all the data sources we have available to us and what are the issues with those. And then how can we group them in ways that make sense and apply like this is the problem here. And then sometimes it's not just one issue, right? Like sometimes there are multiple issues with one single data set.
Right, yeah, absolutely. I often see both the small sample size and the grouping of other and multiple race categories being left out happening in the same data set, where I think we talked about this before. If you just expand into including multiple definitions of race categories, you could overcome that small sample size. So it's also interesting how sometimes the solution is right there in the data set. And it's obvious that all of these issues are important, right? But what would you say the capacity issues are that contribute the most to the gaps that we are seeing? What do you think is most common, and which ones do you think are the most devastating?
Mhm. So I think the good-hearted person in me thinks that the largest capacity issue is ignorance among those who produce data and put out data reports. So it's not I want to say it sometimes it's not an intentional erasure or omission. There are times where I do think it is intentional, that there's a reason that an institution, a state, or a county is not acknowledging the presence of American Indians and Alaska Natives in their data sets. Either way, there's this omission that's happening. And then the largest other contributing factor is, well, we just don't know what to do then. Like, then how? I don't have the know-how, or I think as researchers, sometimes we let the rules among us restrict us instead of thinking, can we change the rules? Can we change the way we play this game? Can we empower the data in front of us and the numbers in front of us to look at a more full story, a more rich story? Instead, there are times we feel restricted by it and then simply just move forward. I also, and this is probably because I just did a presentation yesterday on California Indian history. These are not separate issues. What happens in data, what happened in history, what happens in our K through 12 education system isn't happening in a silo with this data. So if individuals are going through their education system with American Indians only being presented in the past tense, only being presented in the storyline that is a narrative of a colonial narrative and a narrative of establishment and arrival and building, and then in that story is like, oh yeah, and then there were the Indians, and there are like little vignettes of and then there were the Indians, but that's not American history. Actually, we don't consider American history to be American Indian history. It is one of colonial development. So if a person spends their entire life with this narrative, this doesn't mean that they're bad intentioned. It's just how they're being hardwired to see the world and to see what's in front of them. So then if you make it to this career in public health or in this research institution, and you're putting together data and you don't see American Indian, or you see very few of them, it fits inside the same narrative that has been fed to you your whole life, and you don't question it. You don't second guess it. And maybe you put inside, what do Indian people need anyways? They have gaming, they have all of these things. There's like new stereotypes that are really fun to navigate, and I'm sure you all experience that as well. Um, this changing like stereotype of what it means to be American Indian in California. So I feel like it's a really loaded question what you asked, and I know I gave more than because that's what's on my mind. And I know Redbud is also working to address these like K through 12 education issues as well, because they're not inherently separate. It's not just a matter of um, somebody not knowing. It's that being like hardwired to not ask the question and to think of us as in the past, or individuals with who are all really mixed race anyways. And you know what I mean? There's just so much that's built into how we arrive in that space.
Yeah, excellent. I think that you addressed the question perfectly. Yeah, even though that's what's on the front of your mind, I think it's also what's very appropriate to say about these data gaps is that kind of implicit bias, that's the term we always hear about it, but it's also a learned bias that's reinforced by our school systems every year. And I think it's so great to talk about how these impacts that children are receiving in K through 12 education are following them through to their adult lives as professionals. So people in public health and research that never unlearn these things, that never broaden their understanding of Native peoples, will end up replicating these errors over and over again. And this is something I've seen in my career as well. And as you just said, you've seen in yours. Yeah, that was great. And so I would love to actually hear more about how these data gaps show up in your own personal work and the impacts that they've had on the Native community. If you could just expand on that a little.
Yeah, so we can choose a topic that's right in front of us. We can talk about coronavirus, COVID-19. So COVID-19, I think if nobody knew, like I've been saying this quite a bit lately, like many people in my family when I work in public health are like, what do you do? But like, what do you do for like a decade? And now they're like, oh, I see what you do. I get it now. It's like in my social media feed. I understand like this, what is surveillance? What is epidemiology? I'm in some ways grateful that there is like an increased public knowledge about what is public health. So to this issue of like, here's an example. Okay, so COVID-19, you go into testing centers, you indicate your race, you're allowed to select more than one, which is like, considered by many a gold standard, and it is. And then that data gets reported to the state of California. When you're hospitalized for COVID-19, it's a little bit different. If you're admitted through an ER system, it really depends on how the hospital is registering your racial identity. They may assign that to you, in which case you would fall in this box likely of racial misclassification. Particularly if I go to a publicly funded hospital with a Hispanic surname, with brown skin and brown hair, I'm going to be identified as only Hispanic, particularly if I have what appears to be a Hispanic surname, which is very common in California due to the mission system. So there's that. I could also be of mixed descent, of mixed race. So there's that. If I go to a public hospital and I phenotypically appear white, if I have light skin and my last name is Smith, it's likely I'll just be marked as white. Moving on. I mean, I may be experiencing a near-death situation. Nobody is focused on, hey, excuse me, can you make sure that you mark my data profile as American Indian? It's just not top of mind. So that's racial misclassification. So we've had the state reporting race, not right away. Actually, it took a lot of advocacy to get the state of California to produce racial demographics on what's happening here in California with COVID-19. But American Indian and Alaska Natives are showing like we don't really have a problem here. We're like 0.5% of COVID-19 cases. But those are only for those who identify as American Indian Alaska alone. So we can't be more than one race and still be counted as American Indian. There is also deep racial misclassification happening there. So there's all of these yucky problems, almost every like little piece of what's happening here. We also have some counties who are just not reporting race at all in California. In November and December of 2020, the CDC convened a tribal epidemiology work group to produce a report on what the issue, the state of COVID-19 was in Indian country. When they looked at the state of California data, it was so yucky and so unclear that they actually removed California from the data set as they moved forward in their data analysis. And when they did that, they released an MMWR in December 2020 that indicated AIN are contracting COVID-19 at a rate 3.5 times that of our non-Hispanic white counterparts. Also deeply racist ways that we describe individuals, right? Like why we have to say non-Hispanic, why there is Hispanic and then race questions are absolutely political racial boundaries. There is no reason to behave this way. No good reason, but we do it. And so that's always like the quote standard of reporting is against non-Hispanic white. Like side note, Sakui just co-authored a report that was released yesterday where that doesn't happen. And we did it with the advancement project, and the comparison group is the best comparison group. So it's whatever racial category is performing the best for that data set is what American Indians are compared to. It's very confusing. I get it. Even for myself, I'm like, oh my God, this is such an uncomfortable way of presenting the data, but it does help you think about how much we are wired to say that white, non-Hispanic white is the bar. Like that's the bar of which we should all be working to achieve. So we should like counter that narrative too. So COVID-19 is a great example of where we see there is some data, what can be wrong with the data, and really verified by the CDC is really wrong here in California, to the point that we don't rely on California data to understand what's happening in Indian country.
Excellent. Yeah, that was a great explanation. And I appreciate your comment at the top about not having to explain what public health is anymore. That I think that was repeated 3 or 4 times during but I graduated yesterday, and every single speech was like, you don't have to tell people anymore what public health is. And it's like, oh yeah.
We also never thought this field would get anybody a death threat, but here we are.
I mean, the world's changing before us every day, right? But great. And I really want to dig into something you said during your response about the quality of data from California specifically. When we were talking in preparation for this event, you had mentioned that there are different levels of clarity and like quality of data depending on state. Could you unpack that concept a little bit for us? Because I didn't even understand that until we had that conversation.
Yeah, so it really depends on the visibility of tribes in the state and how well the state reports race data for American Indians. So for example, in areas and in states where there are large, what we call large land-based, meaning they have a large federal allotments of land held in trust, known as reservations or trust land for tribal individuals. Where there is more land for American Indian people in a state, there's a greater recognition of the presence of American Indians, and therefore better data reporting by state and counties. It's imperfect, but that's just what the data tells us. There's less racial misclassification in Arizona, in New Mexico, in South Dakota, and Montana. When you get to the West Coast, where there's no more places that you could push Indians except for into the Pacific Ocean, then you just give them smaller pieces of land, right? So we have very small land bases relatively here in California compared to others. People are surprised when I show them a map of California when they say, oh, I've never been to a reservation in California. I'm like, well, have you ever been to Lake County? Because you drove through like 6 of them on your way to the 101. Yes, you have. You just weren't paying attention. Like again, we're not wired to see it around us. So states have different racial misclassification based on really like you can equate it to like the amount of land and the physical presence of a tribe in that state.
Great, yeah. And so the quality of data that comes from those states, you would say is a higher quality because there's more visibility, or is it just that there's a higher quantity?
It's not that there's a higher quantity, right? Because California has the largest number of American Indians and Alaska Natives compared to any other state. 1 in 7 American Indians in the United States lives in California. Like it's California. California is Indian country. Wherever you're at, we have the highest population. We also have the greatest number of federally recognized tribes. of any state, with the exception of Alaska and Alaska Native villages, which are sort of a different historical composition. So it's not necessarily quantity, right? Like we have a presence, we have numbers, we have tribes. It's really that like land-based issue. And then there are other like things to be confronted with, like number of elected leaders in the legislature, like presence at the electoral level as well. California elected our very first California tribal member to our state assembly just in this last year, in the last 2 years. So there's also like visibility at all levels absolutely impacts the way that a government deals with Indigenous people. We see that at the federal level, when we have 2 Indigenous women elected to Congress, and they have gotten a lot of work done really by being in the building.
Right. Yeah, definitely. Great. Excellent. So one of the other things that we've spoken about previously is the issue of breakdown of conversation between public health organization and Native communities. Can you discuss how this breakdown happens and how it impacts your work a little further?
Madison, say more about that. What
So,
do you mean?
so you had talked about how there's public health organizations that are trying to improve health outcomes in a community, and they're not reaching out to Native organizations, Native stakeholders, or Native governments in the area. And that breakdown of communication is having impacts on the quality of data and the quality of work that those public health organizations are able to put out.
Absolutely. So the state of California has poured millions of dollars at the state government level and into community-based organizations and to the counties to combat COVID-19. If individuals who are putting out these COVID-19 campaigns don't really understand what's happening at the ground level, their campaigns are not effective. A really great example of this relates to the issue of maternal child health and sudden infant death syndrome. So the nation on a whole introduced a back to sleep campaign about 25, 30 years ago. And the back to sleep campaign essentially was just make sure that your babies are on their back to sleep. It used to be that, and trust me, I think any young mother has had a grandmother or an auntie tell you, oh, you're putting your baby to bed wrong. But there was this whole campaign to educate families about putting babies on their backs to sleep. And it was wildly successful, actually. We saw a decline, a steady decline in sudden infant death syndrome among all races except for American Indians. And we only recently were able to say that in the state of California by convening a work group of people to work with the state of California on the MIHA, on the Maternal Infant Health Assessment Survey. So state of California does a survey among recently born babies in the state, and then we can say something about those babies. Were they healthy? Were they preterm? All of these things. When they were producing this report, the only babies that counted as Indian babies were babies born to women who only identified as American Indian. So let's break that down. If the baby's father was American Indian, baby not counted as American Indian. If the mother was more than one race, baby not counted as American Indian. So for us, we're at the community level, right? Like just at a community level, we're like, wait a minute. How is the race of the father not contributing to the race of the baby? Again, these like really deeply racist practices that we just don't like unpack. So when we did that, we went from having like 1,200 babies to look at to over 10,000 babies to say like, this is a cohort of babies we can say something about. And we saw that in fact, we had a steady rate of sudden infant death syndrome despite the back to sleep campaign. So while the back to sleep campaign was successful, it had never been vetted in Indigenous communities. It had never been put through an Indigenous lens to say, what does this look like for us? What are practices that come from our communities that would work? And this is where like public health falls apart, when we build a gold standard based on the general public and we don't take a look at the communities that we're actually intended to serve. We won't see the needles move. We won't see the markers move, despite you can pour any millions of dollars into a campaign. If it's not vetted through community, understood by community, and produced by community, it's very likely you're not going to see the response that you're looking for. And you would never know that there was this problem of sudden infant death syndrome if you didn't start at the data first and have somebody questioning what is happening here. What is happening? Because as Indigenous women, I know several babies who have died in this way. So you can't tell me that this isn't a problem. Anecdotally, on the ground, we know this is a problem. And we can scream it from the rooftops as much as we want to the state. The state isn't going to listen until you put data in front of them and say, I'm not just saying it. I'm not just crying about it. I'm not just feeling it. It is definitively happening, which is also a really disgusting process, but really underscores why this issue of data is so important and why everybody should be super fired up about all of these problems.
Right, absolutely. Those are that's an amazing story, and those are really wonderful points. It really makes me think of the importance of community-based participatory research that is now gaining a lot of traction within public health and also the teaching of public health. It was one of the first things I learned in my program was the importance of you don't intervene from outside of the community, you build with the community. And so I think that's just a really wonderful example of the importance of that inclusion of Native voices in research, interventions, programming that impacts our communities. So another question that I have about these data capacity issues is specifically the very definitions of American Indian, Alaska Native. So I know that we have federally recognized, state recognized, and unrecognized tribal nations. There's also people who self-recognize as Native, and then there's indigenous peoples from other countries that come and immigrate into America. So how do those definitions fit into data? And then what other definitions that exist that I may not know about or people in our audience may not be familiar with?
Yeah, so that's a really great question. And it really does matter on this question of like who counts, right? Like that's the biggest thing when you're looking at data is who counts. So there's this issue of like, do people who are multi-race, do they count? Do we count them as American Indian or not? Which is wild that we have to ask that question. But anyone who's dealt with data, you have to ask these questions like who counts? Like who counts for my groups? So there's the self-identified. So take something like the census. The census is a place where you self-identify. You select your own box. You are American Indian Alaska Native. And then it gives you an opportunity from a drop-down list to choose a list of federally recognized tribes. If you're not a member of a federally recognized tribe, there is no drop-down for you to select. There's this issue of, let's say you're receiving services through the Indian healthcare delivery system. In California, that would either be a tribal health program or an urban Indian organization. In other states, you might be going to a direct federally funded IHS facility. In any of those cases, if you self-identify as American Indian, that's great, but they're going to ask you to prove it. You have to show with certainty you're American Indian. So you need to show your tribal enrollment documents, or you needed to show that your parent is a member of a federally recognized tribe. So that would make you an American Indian of the first descent. To access services through an urban Indian organization, there is some language that says you can be American Indian and receive services on the basis of that if you're in the second degree. So your grandparent is a member of a federally recognized tribe, which acknowledges federally funded and sponsored relocation programs that relocated individuals to urban areas. So it secures some rights to services for their grandchildren. So those are all definitions, like who counts? Are we talking only about members of federally recognized tribes, members of those to the first degree, members to the second degree? Are we talking about anybody who just self-identifies as American Indian? This whole issue of what if they're American Indian and Hispanic? Do we get to say that? Or are we only looking at non-Hispanic American Indians? So those are all very definitions. And to your point, we do have this issue of indigenous peoples from the Americas. For example, I have a woman on my staff who's First Nations, born and raised in Canada. That's her identity. She's Anishinaabe. She speaks part of her language. What does she mark on a box? Is she American Indian Alaska Native? What does she do when she completes the census? Certainly she is. To me, yes, the obvious answer is yes. But really, does she count? Does she? Her people do not have the same exact historical interactions, political interactions that we do in the States with the US government, but she's going to mark American Indian Alaska Native. What makes people more uncomfortable is when we go south of the border, when we start talking about indigenous peoples from Mexico, whose maybe their first language is not Spanish, and they primarily identify as tribal people. What do they mark on the census? They are not going to mark white. They're not going to mark, what is the category that they get to pick? The only category that really resonates with this group of Indigenous people is American Indian Alaska Native. This is an Indigenous person from the Americas. So then do they count? Some of the times we're looking at data sets that we'll never have any idea of knowing, right? We just have to pick it and move forward. We typically push, like as a general practice, for the most culturally inclusive and culturally responsive definition, which is American Indian Alaska Native alone or in combination with another race, Hispanic or non-Hispanic. Many of us who are mixed race have been taught as a cultural practice to acknowledge our ancestors on all sides, both Indigenous and non-Indigenous. And so we have a responsibility, we have felt, and for the first 25 years of my life, had a responsibility for marking more than one race. What I didn't know is by doing that, by honoring both sides of my family, I was effectively erasing myself from data sets. So it's a practice I don't do anymore. It's something I don't encourage Indigenous people to do, but it is a cultural practice that we're taught to do.
Right. Yeah, I empathize with that deeply because I also went through that, doing that and then changing to only doing single American Indian Alaska Native on my data sets because I knew that I would be erased otherwise. And so it's very strange to go through that moment personally. And so before we start moving into how to address and overcome these data gaps, I just have one more question for you, which is we've talked a lot about how these data gaps exist within healthcare and public health data sets, but you also see them outside of the healthcare area. And could you talk about that a little more?
Yeah. So I've had to step away from it for a bit, but I used to and still do serve on our American Indian Education Parent Advisory Committee for my local school district, where I have 4 children in district. And we get a set aside of money, the dollars we get, California Department of Education dollars for American Indian students within our district. And then as a parent advisory committee, we can dictate how we want those dollars spent. We are in a district that, and a self-identified, when you look at the population of our students, we have a pretty high percentage relatively of American Indian students in our district. However, the funding allocation we get isn't represented. We don't get the funding allocation for students who only self-identify as American Indian. The only time that we get dollars to that increase our Department of Education funds are for students who complete what's known as a 506 form. And to complete that 506 form, you have to say you're a member of a federally recognized tribe, or you're the child of a member of a federally recognized tribe. And so you have to submit that documentation for yourself or for your parent. And then you are recognized by the Department of Education as an Indian education student. We don't operate that way. The Parent Advisory Committee does all programming for any student who identifies American Indian, but we're only receiving about 20% of the funds that we would if the inclusive definition was all students who self-identify as American Indian Alaska Native. So this is a huge, like, trickle pieces. Now, when I was an undergraduate and a student advocate, we would get outreach numbers for new admittees, and we would get a couple hundred people who I self-identified as American Indian. And unfortunately, so often when we call these individuals, they would say, I don't primarily identify as American Indian. I just thought it might help on my application process. Don't call back. So then you run into those issues in education, right? And we have scholars who have, like, moved up the academic chain on the basis of checking a diversity box. And so this whole issue of, like, self-identifying as being such a positive thing, but also one that does make room for some yucky space, is absolutely there as well. So there is, as I advocate for, like, all inclusive definitions, I do know that there are spaces where we should really be asking the tough questions, like asking the questions that kind of make us be like, oh, that's uncomfortable. We probably shouldn't ask that, but maybe we should. Maybe we should, particularly when we may be promoting people through spaces. So yes, these issues of, like, data and identification are deeply, deeply in nearly any field that you enter into, education just being one of them. I mentioned politics and democracy earlier, and what it means. There have been other American Indian people in the state assembly. There absolutely have other members of tribes outside of California. So when we say that we had our first California member of a California tribe elected to the state assembly, that's exactly what we mean. So, again, you could take any real field and take a look at racial breakdowns and look at who's counting and who's not.
Great. Yeah, that you did a great job of explaining the pervasiveness of this issue. And I think this really emphasizes the necessity of researchers in all fields addressing this. So let's break down how people can do this. So in the Sukui report, there were suggestions put forward for changes within the California Department of Healthcare Services State Epidemiological Work Group, which you mentioned at the beginning of this event. These changes focused on not only the existence of these data gaps and really focusing in on them, but also the building of stronger relationships with the Native community and providing more opportunities to meaningfully include Native voices in the social epidemiological work group. These requests were followed by recommendations for SUE to request changes from DHCS directly, changes such as broadening race categories, which we were just addressing, to address the issues of the Native erasure of combination Native identifications, and also solidifying that definition of who is and isn't Native. And then finally, Sukui lists requests SUE should make to other state departments and agencies to fill in these gaps in those places, which I think lines up very well with what you were just saying about how this exists everywhere. And so these are excellent strategies for increasing the visibility of Native peoples in data. And what are some practices that individual researchers can implement in their own work to accomplish the same goal of filling in these gaps?
So it's absolutely working with tribal practitioners, working with tribal epidemiology centers, working with folks who have a proven track record of doing this work. Sometimes people will push back and say, our table's just not big enough for another voice at the table. And so it's like, well, remove a voice. One, if you literally can't make the table bigger, then remove somebody. Or two, make the table bigger. Like, let's extend the conversation. And there is sometimes frustration in doing this work because through a Western lens, we're so centered on timelines that something has to be done right here. And if it can't be done, then we just simply can't do it. And sometimes we're talking about like literally life and death situations, like programmatic funding that can change people's lives or save lives. And so what's another 6 weeks? Let's put this through a tribal review process. And if the tribal review process comes back with something you don't like, be prepared for that. Know and understand that we need to look at this again to better understand how this may or may not impact a group of people. One thing that wasn't mentioned on the slide before and also has played out in COVID is American Indian people are not often the first in line to participate in research. Because of longstanding historical research abuses to Indigenous communities. And so often when new research comes out, the very first question people have been asking me about these vaccines is, how do we know they're safe for Indian country? And so fortunately, these pharmaceutical companies who produce these vaccines did very targeted and specific outreach to include American Indian people in their research cohorts. And so we also need to be asking ourselves that if we do not have American Indian people represented in our research data set, why? What more could we do to outreach? What cultural practices? Are we calling the right people? Typically phone banking doesn't reach Indian country. Anybody who has Indian family knows that our numbers change with frequency. I save everybody, all my family members' names by the year of they got that phone number because it just changes that often. So there's also that, like a lack of representation in new research and emerging research as well.
Great, those are really wonderful strategies. And also something I heard you discuss previously was the importance of being able to identify bad data concerning Native populations and how to respond to it. Can you share some of the strategies you use to better understand the quality of data when working with Native communities?
Yep. So I always look for method sections to understand, again, the question of like who counts, who counted it, when did they count it, and where did they get it? So when I say that California is home to the largest population of American Indians and Alaska Natives, 90% of them live in a metropolitan area, which really counters this narrative that we are all living on rural reservations. We're there too. We're everywhere is my main point, but we're also right here in the urban setting as well. And so if a study was done in Los Angeles, what did it do to outreach to American Indian people? You just go through that list of problematic things with the data and understand what are the issues. And then sometimes you can offer real strategies. So for example, in California, we have public access to something called the California Health Interview Survey, commonly referred to as CHIS. With CHIS, you can't usually get statistically reliable data for American Indians if you choose any given year. But if you ask the query database to pool a number of years, so give me 2012, give me 2007, give me like 3 years of data sets, then I might get a sample size large enough to say that American Indians are disproportionately impacted by asthma. I couldn't do that if I only looked at 2012. I have to look at several 5-year blocks to get a sample size that's statistically stable to say, yes, we definitively are disproportionately impacted by asthma. We smoke more. So those are other strategies, is to pool years, to select a number of years. You can do that in a couple of other databases as well to get a sample size that is larger. Again, due to federally and state sponsored genocidal policies, we are a smaller population. It's absolutely true. We are a smaller population. We are a minority among minorities. That is absolutely true. And you will have to do a little bit of hard work to get a sample size so that you can get statistical significance.
Great. Yeah, thank you for sharing those. And we're going to open up for our audience Q&A real soon here, but I just wanted Virginia for a last little tidbit here. What would you say is the biggest message you would like our audience to leave with today? And could you talk a little bit about how you envision the world will look once these data gaps are filled in?
Yeah, so I think like the biggest piece of advice I give is to do the hard work. It's not hard. Nothing that I mean, it's all hard. None of the suggestions that I've given are just, click of a mouse. It is hard work. Don't be afraid of it. Do it anyways. Be okay with being uncomfortable with what you're seeing. Question what you're seeing. Understand the deep racist impacts when we're omitted from data. Understand what that's like for an Indigenous kid who's looking at a fact sheet and we're not represented as a bar on a chart. And then you take that and you like align it with suicide rates and you align it with substance use. These things are not detached. Like we don't just end up with the top rating. We're winning all the races for disparities. It doesn't just happen magically. It happens systematically over time. So to question that, I think those are my biggest things. And then to the point of like a world I envision is when we better understand what our needs are. So I always say, like, if we don't know what we're dying from, there's nothing we can do to fix it. So we have to understand like what are our true leading causes of death. A true leading cause of death for American Indians ages 1 through 44 is that we die in motor vehicle accidents. So let's buckle up. Let's talk about buckling up every time. That's a proven strategy to reduce deaths due to motor vehicle accidents. It's very simple. So sometimes there are very simple solutions when you have good data in front of you.
Absolutely. Great. Well, this was such a wonderful conversation, and we're going to continue it with Q&A. I know we're almost at the hour, so if you'd like to stay for the Q&A, I invite you to, but thank you all so much for joining us here today. And if you have questions, you can either raise your hand or put it in the chat. And I know that my co-founder here, Taylor, is going to be moderating the chat and bringing up questions. Taylor, are you there?
Yeah, a question came up earlier. I tried to address it, but somebody was asking if we had any insight or feedback into how to effectively convince coworkers to broaden or shift their perspective of the Native identity and data if they aren't familiar with it. Like, how do you convince people that this is important and that it matters?
Pray about it. No, I'm just kidding, but you should. I mean, we're in this world, right, where people are doing really ugly things. Like we're in in California, we just experienced a mass shooting, and I'm not relating these two things. I'm just saying, like, there are really horrific things happening, and our nation as a nation has been so polarized over the last 4 years that we're in a really weird space. So when I'm asked this whole like convinced question, it's tough. I've been doing public health messaging on combating this pandemic for the last year, and I've tried hard not to convince anybody of anything, but to simply put information in front of people and say, can we have a conversation? Let's talk about what you think. Let's talk about what I think. And maybe one of our minds will change. Maybe we'll have a broadened perspective. So I'm sort of under this belief that we can't enter a conversation with the motivation of convincing somebody. They're either going to accept what you're giving to them or not. Have them read our report as one, right? Like if they're in data, have them read our report and then say, hey, after you have a chance to read it, it's a quick read. Let's have a conversation. Or our most recent report that we just released yesterday that has some interesting data points to talk about. Or have them say, like, what if this were you? What if this was your racial category being erased or diminished? I think that you're going to have to just try to get to people on a personal level, talk about the deep impacts. The maternal child health survey that I gave you as an example is a really clear one for me. We should all be worried and care about our babies. And the data is really evident. There were positives from that. So I also like to be strength-based. We found that Indigenous women breastfeed longer than non-Indigenous women, which is really great. And something that we should look at Indigenous women about what are successful practices. And maybe there are things we can learn from our community that other communities could benefit from. I think there are practices throughout COVID that tribal communities have absolutely nailed in supporting their families and households during this time that other communities could learn from. So I think it's about, like, if we're in public health, we're generally looking at and care about public and community and people on a whole. And so we can't be approaching these issues as if we're individuals, like we're all a part of a greater community. And if anyone has learned anything from COVID, it is that one cruise ship landing in the San Francisco Bay could change the course of our lives, right? Really, like this ripple effect, it should be hopefully the clearest example for people about what a ripple effect really is in public health.
Yeah, and I think one more question that I have gotten from a lot of Native and Indigenous people that I think would just be really great to end on is, and you mentioned this a little bit, but how are we supposed to identify ourselves? And I'm thinking about people who are a part of federally recognized tribes, non-federally recognized, but also Indigenous people from north or south of the border. What are we supposed to do?
Yeah, like what are the terms? Like what's the right term to use? Is that the question?
Yeah.
So I typically say that I'm an Indian woman, and I want to recognize that that's not politically correct, and it's not something that I typically say people from outside of our community, so non-Indian people, should use. My grandmother was an Indian woman. She was an Indian woman on the census. Her parents were Indian women. We are on an Indian reservation, governed by federal Indian law. I advocate for dollars from the Indian Health Service and from the Bureau of Indian Affairs and Indian Education. I'm intentionally using this word over and over because that's the word that comes to top of mind for me. There are more politically correct words. I think two that come up often are American Indian and Alaska Native, and it's really like city, county specific on what local community likes there. The other term that has been really popular is Indigenous. And what does it mean to be Indigenous? And how is that a decolonial term? We're talking about people who are from a place and land as being Indigenous to that place. And really, we all have Indigenous roots somewhere. So we've, in some ways, co-opted this term Indigenous to only mean Indigenous from this place, but everybody is Indigenous from somewhere and should do their homework to figure that part out. When I use the term Indigenous, I'm intentionally using it as an all-inclusive term. I'm talking about Indigenous people from the Americas in general, or I'm talking about California Indigenous, like here in this place that I am now. I think that term can be problematic when you're specifically talking about American Indians. So we should be very purposeful and intentional with our language. When we're talking about American Indians and Alaska Natives, we're talking about a group of people who have historical and political interactions with the United States government and whose health outcomes are determined by that history, which is not the same for all Indigenous people who have other historical interactions. So I think they're all good. Moral of the story, every term is good. Depends on like the who, what, where, when, right? Among my own people, I'm Yurok, I'm from Shregon, I'm a Myers. There are other terms of identity. There are also identity questions that we're all asking ourselves now around gender, right? That's an emerging practice, is that we share our gender, that we say our personal pronouns. And I think in some spaces that's a great space. My first personal pronoun is that I'm Yurok. It's not based on that I'm a female or a male or a he or a she. I could care less one way or the other. As long as you get me right that I'm Yurok, that's where I'm from. That's my primary identity. So we should be asking ourselves, like, if we're talking about decolonizing spaces or thinking about broadening spaces, what are all of the identities that individuals would like to put first? So a lot on that.
That's great. I really enjoy your approach to personal identity and identifiers like that, where you put your identity as a Yurok person first. That's really interesting. I hadn't heard it put that way before. When you think about how these identities translate into how you fill out forms when you're going through personal identification and data collection, it's much more confined than the freedom we have in our own speech and our own personal identifications. This is something that when I was working at the National Institutes of Health, I was on a board, or not really on the board, I was an intern in the corner with a notebook watching much more advanced people make decisions, but I watched it happen. There were people at a symposium who were discussing how to redefine identity categories in the census. And basically the agreement around everyone there was, you can't do it right because it's words on a paper, it's a box you check. It's never going to capture all identities, it's too confining. But working with what we have now, what kind of advice would you give Native people as they fill out that census or they check them, that they go through the paperwork at hospitals?
You only check one box. You
Okay.
only check one box. It's the only, we can have conversations like we're having here today, which I hope people will leave this space and do something different in their practice, or it will change the way that individuals give a review or think about funding decisions when a nonprofit is presenting fund me for this and their data is lacking to understand that maybe the data doesn't exist. I hope that happens. But in the immediate, I think American Indian Alaska Native people have to stop marking multiple boxes. I can't say I'm white and American Indian. I can only just say I'm American Indian. I recently did connect with family that says that I'm also Mexican, and that's challenged my identity too. Do I add that in the box? Do I not? So fundamentally in practice, I think American Indian Alaska Native people who primarily self-identify as American Indian Alaska Native should only mark that box and no other box, despite their actual cultural or genealogical makeup, because we're just not there yet. Maybe in 10 years, maybe in 20, maybe in 50, we'll be there at a place where data reporting is more sophisticated or acknowledges people, indigenous people for in the way that we are, but we're not there yet.
Yeah, I definitely agree with that. And in saying that we're not there yet, I don't know if we'll ever get there, honestly, from the conversations I've sat in on, from what I know about the census and the way that these research documents are made when you're taking people into your programs. It's very hard to try to embrace intersectionality in these spaces, which is gaining more traction within the world of research, but is being conceptualized and operationalized in ways that I do not think actually meet the mark. So I don't want to confine people to my current level of creativity because I'm absolutely a novice, but I have yet to see a very solid way of capturing those intersectional identities. Oh, we have another question.
Yeah, well, so Maddie, I'm reading this question and it's like, what if you have multiple marginalized identities, such as being Black and Native? And I think it's a really good question. And something that brings up for me is, yeah, how do you decide which one to choose? Because we realize that there's implications when you choose more than one. So how do you decide which one to choose?
This happens often. Particularly this idea of being Black and Native is something that we're confronted with, right? And my husband works with a number of youth who share these identities, and there's not a great answer. Individuals should do what they're most comfortable with doing, right? That, being of utmost importance. But second to that, we are a minority among minorities. So even when you look at African-American or Black as a racial category in race reporting and data, it's better than American Indian, Alaska Native in terms of the numbers, in terms of the presence. In fact, I often say, like, what if you looked at a health chart and you all of a sudden didn't see white represented there, all of a sudden didn't see Black represented there? People would be like, oh, something's wrong with this. But we don't do that. We don't have that same reaction when we don't see American Indian, Alaska Native. In fact, we just think, oh, there's not very many of them anyway, right? Like, that's probably what it is. Move along. So I think that's where my advocacy is there, and it is tough. It is tough. Absolutely.
All right, are there more questions coming in, Taylor? Do you have any more questions?
Well, I know that there are people here from lots of different states and multiple fields. So if you have a specific question that might apply to a specific field that you work in, I think that would be really interesting. We do have a lot of teachers here. And I'm curious, there's not a specific question right now, Virginia, but I'm wondering if you have any advice for educators who might be working with Native families or families that are secretly Native.
Yeah. I think like how we talk about American Indian, Alaska Native people is really important, particularly in the classroom. So when we use past tense words, it's really powerful. It's really powerful for students in your classroom. It's really, really important to talk about Indigenous people in the present day. So just a few years ago, my son was in the 2nd grade, and his teacher was reading a passage about how Mighty people used clap sticks. And he never speaks in class. He's very, very shy. He hates public speaking, but he raised his hand and he said, actually, we call them clapper sticks. And it was the first time that she was like hearing him speak aloud and raise his hand, but it was his opportunity to say, and he said, Mom, they said that Mighty people used, like, we don't still use them. So I told her, like, we still use them. We call them clapper sticks. I have one. We use them when we play hand games. We use them at ceremony. We use them all the time. And so she, then asked him, would you like to talk to the class about it? And he did. And he was really grateful for the opportunity to do that. And then he did another classroom. It was a really beautiful experience. Not the point of the story. The point of the story is what happens to the student who doesn't raise their hand, who doesn't say, this is what it's called, and I'm still here, or who is Pagoy's friend, my son's friend in later years, who thinks Pagoy's this relic. He's this walking dinosaur because he's the only Indian he's ever met, right? We have to talk about American Indian people in the present.
Yeah, absolutely. And there's also a question here. It's a kind of clarifying question. What do you recommend for answering the Hispanic or non-Hispanic ethnicity? So if you answer, it's someone who's mixed Hispanic and American Indian. If they just identify as Hispanic, if they identify as both American Indian and Hispanic, what happens to their data?
So a really often practice is to choose non-Hispanic whatever. So non-Hispanic white, non-Hispanic AIAN, non-Hispanic Black. Again, this goes to like deeply racist behaviors, the racism that's deeply rooted in why we do the census in the first place and why we ask racial categories there. So I'm hesitant to share what people should do, but if you mark that you are Hispanic and American Indian and someone is then dissecting the data, it is very likely that they will choose non-Hispanic American Indian. And so you then wouldn't get counted because now you're going to fall into a multiracial category, and in their data set, you will fall as other or multi-race. If the data set is sophisticated enough where a statistician can choose who counts, so we're going to say like Hispanic counts, non-Hispanic counts, American Indian, and any other race counts, then you're fine. If people are following some of the recommendations that we've laid out in our report, more often than not, they are not following those recommendations, and you will not be represented in the data.
Okay. And then well, we have someone here who works with the government in housing and community development, and they're wondering if there's any existing data gaps that are similar to what you're talking about in relation to housing.
All of it, like ditto to all of it in housing. It all comes down to completing those forms, right? Yeah, it absolutely happens in housing. And the report that I told you yesterday has some housing data in it.
Okay, great. Very cool.
And I have posted the link to where you can find all of these reports on the Sakui website earlier in the chat, but I'm posting it again right now. And there's a lot of really great reports and information on this website, and that Sakui regularly puts out. The report we talked about today, the data profile, is very quick, concise, and still very all-encompassing report. It's like maybe 19 pages long, but you get so much out of it. And if you're in different sectors, it breaks down where those data gaps are all across the healthcare public health kind of ecosystem. And those places also overlap a lot. What was that?
Virginia, I have another question because I'm a teacher and I do curriculum development, and I'm often trying to bring in data into my lessons about history and then science. And I'm curious, just like knowing, and this is like not necessarily related to now, but knowing that Native voices and Native people were not necessarily a part of the historical data collection process during like the gold rush, during the genocide, during the mission system. How are we supposed to interpret that historical data, knowing that the Native voice has been manipulated?
Yeah, so I always just absolutely question it on the forefront. In the presentation that I gave yesterday, when I talked about the genocide of California Indian people, I think it's really powerful to point out what we know about the genocide of California Indian people was written by Spanish people, was written by European settlers. So if they said that their peers were horrifically murdering women and children, imagine how an Indigenous person would tell that story. If a peer was saying, this startled me when Father Juana Pacera did this to an enslaved Indian children, this. So if their peers said this about them, we can only imagine what someone living through the experience would say about that experience. So in some ways, I find that that there is some empowerment in that when we look at alternative voices in history and absolutely American genocide. Taylor is a great resource for that. So I think the piece is to just question it in all of this, like question what you're seeing, have some conversation with yourself about what are you inserting yourself, like your own history, your own identity into your curriculum, and how will that translate to your students?
Mm. And then I'm going to ask another question. I'm thinking about curriculum and science curriculum in particular, and how we at Redbud are really pushing for the integration of lessons about traditional ecological knowledge and Indigenous ways of caring for the land. One of the big pushbacks we get from teachers is that there is not Western data to back up our scientific knowledge. And I'm curious, I realize this is not public health, but what's your response to that in the way that, yeah.
So like my Indigenous ego is like, we'll give it like 50 or 100 years. Western science is always behind us. It's always like working to catch up with us, right? So like, for example, we've been burning sage since the beginning of time, knowing that it has healing properties, knowing what it does for our people. And in the last 10 years, Western science has come out and said, like, sounding the alarms. Did you know that by burning sage, it has antibacterial properties and quite literally clean the air? And Indigenous elders are like, yeah, duh. Like, we've been doing this. Like, what do you think we've been doing this whole time? And we're seeing that with things like prescription burns, like when we burn our forests and we care for our forests. Early anthropologists wrote us as savages that burn their land. Like, these people are crazy. They burn their land. And now we're in 2020 and 2021, and Cal Fire is saying we should probably do some prescription burns. Like, maybe these Indians aren't so crazy. And as it turns out, like, fighting fire with fire is a gold standard practice, and prescription burns is absolutely what California needs. So the pushback to, well, we don't have Western sciences, just give it time. Just give it time. It'll be there. So you're either going to be like, where do you want to be in this like pioneering stage? Do you want to be on the forefront of this and saying, I was doing this as a practice before the data even got there, I've been ahead of the game here? Or are you going to sit back and wait and see education and see Indigenous students continue to struggle through academic because of teachers like, themselves, who are unwilling to teach and adopt practices that will in 20 or 30 years be the gold standard?
Yeah, and I think that it really does relate to this topic. I don't know if would technically be participatory based research, but it is community based research, right? Like our data and TEK is in stories, it's in songs, and it's written onto the landscape, right? And that's the data. And so it's maybe not traditional data in the Western sense, but it is data.
That's right.
Mm-hmm.
I'd also like to just emphasize how true what you're saying is, Virginia, because it goes so much further than just our traditional ecological practices to the way that we interact with each other now coming into the Western forefront of like, this is the right way to do it. When I was interviewing for medical schools, I had so many schools that were excited to tell me that they were switching to a relationship-based approach to medicine. And they're like, it's so great, it's so revolutionary. We're one of the first schools to do this. And I'm like, yeah, I mean, Native people, that's how we've approached our medicine forever. You can't sit there and tell me that you came up with this. Mm-hmm. And I think that's another aspect of this way of Western research changing over time that also needs to be addressed. You have a lot of Western researchers and people at the front of Western science that are like, look at this thing we discovered, even though it's existed in Native communities for thousands of years.
That's right.
And yeah, I feel like that needs a louder voice behind it.
Yeah, like we have to have publications now that prove that like mind, body, spirit are connected, and that like if you're stressed, it will impact your heart. Like what? We have to have scientific proof of that? That's wild. Indigenous people have been saying this since the beginning of time, that your mental health impacts your physical health. If you're not well spiritually, if you're not well mentally, you will see manifestations of that physically. It seems so straightforward, but literally the medical field is waiting for documented studies to come out to say, yes, stress definitively impacts the heart. It's just it's wild to me.
It's something I struggle a lot with as a researcher, is there's so much knowledge that is held by Native peoples. And do you go through the effort of proving yourself to a Western system that has oppressed your people, marginalized your voices, and ignored your existence for so long just to be good enough to be considered real information from that side? Or do you just completely ignore that process and keep doing what you're doing? I'm very much on the fence of how to navigate that space, because I was trained as Western researcher, but I'm, from the Native community. So how do you tackle that in your work?
Yeah, so number one, it's exhausting, right? And like so much in like K through 12 education, the answer is like, let's bring an Indian in and they'll present to the class. Like, why does the burden have to be on Indian people to teach an accurate history? Like, can we all like just be a better educator, right? And like do what's right? Why do we have to bring in a prop? Like, we don't bring a prop in for every other history lesson. Like, we are required to teach history as it is, as it's accurate. I'm not against bringing in Indigenous people. I've been in many classrooms, so have my kids, so have my husband. I do think it's a great practice, but it shouldn't be the crutch that we lean on to say like, oh, this is what I do to make it good. We should be doing those practices all of the time. So the labor, I think that's what you're getting at, Madison. The labor for these pieces should not always be on Indigenous people to fix the problem. Nor should we just be a diversity checkbox of, well, my committee included an Indian woman, like she's a woman and she's Indian, so like there's two, move on. We can't do these things just for the sake of doing them. And there have been tables that I have left because I felt the process was disingenuous. And I said, I don't have time to be at your table if you're not going to hear what I'm saying. I'm not forcing you to do something, but I'm out. I'm not going to co-sign this. You're not going to have my name on whatever it is you're doing if you're unwilling to change or make the changes. So to the point of being exhausting, absolutely. Are there times you get up and leave? Absolutely. Absolutely. Leave the table. If your voice isn't heard, leave it. Don't be a diversity checkbox of any of those pieces, because we shouldn't have to hold the labor and the weight of all of it, particularly if you're not seeing effective change making. There are other hills that we climb that you just have to keep pushing, right? There are other battles that it's like, I'm just going to keep screaming this until someone listens. So I think it's all about like picking the battle and knowing like what the end game payout is.
Right. Yeah, it's definitely
It's a lot.
Yeah. And I think that something else that happens in that space a lot is the expectation of extra work without receiving extra compensation. I know that happens in schools a lot. I saw that happen in research settings a lot, where people of color, Native people were invited in to sit on a board or review board and look over this paper. Is this racist? And you go through and you do all of this work, and when you hand it back, the person says, okay, thanks. And either they completely ignore what you say, or they implement it with no credit. And for professionals that are being asked to lead DE&I workshops because they're a person of color that works within that setting, not getting that extra compensation, I think is another step away from allyship. So yeah, I think there's so many factors that work into this, especially as a person doing the research. Yeah.
Yep. All
right, is there another question, Taylor?
I don't think so. I think we covered everything.
Yeah.
I don't have a fully formed question here, Virginia, but something that I hear all the time from Native people is that our tribe, our committee, whatever, was invited to speak and give our feedback on a specific topic to the government, right? Could be like natural resource distribution, it could be development, something. And they almost always come back and say, I gave my feedback and they ignored me. Yeah, what's your, I don't know if the advice is to the Native people, or if, or maybe there's some advice to be given to the organizations who are inviting Native people and don't actually have the mindset to listen. I'm just curious if you have any thoughts on best practices on how to improve that experience for Native people.
Mm-hmm. I think the best, so I have had some experience in helping state agencies and federal agencies set up consultation processes. And so I think that is the recommendation is for agencies to implement consultative processes that have steps and procedures built in, such as note-taking, minute-taking, follow-up, back to the tribe. And then from the tribal piece is to say, are we following a consultation process? Will this be recorded? Will my feedback be given back? So typically when SACUI enters into a consultation process with either a state or federal agency, our expectation is that that agency will give us a report back on what they heard us say and what the questions were. If we don't have as great of a trust-built relationship with them, when we enter the consultative process, we will give them on the front our list of concerns, questions, and edits to whatever they're giving us in paper and written. And so we'll file it formally. That typically only works if that agency has a consultation process. And this consultation process hasn't really trickled down to other governments like county governments or school boards or things like that. But there are models out there that work where consultation happens in an effective manner. And then I think it's not just enough to be heard, right? It's that action piece. Indigenous people don't want to just show up just to be heard. We want to be heard, seen, and see the results of the work. So it's always nice when you can have a written format of that and then be able to make corrections to the agency of that's what I said or that's not what I said. And then follow that paper trail along so you can keep pushing for advocacy. And it's a long process. SACUI has been advocating for almost 15 years to be treated like an equal part of the Indian healthcare delivery system and have access to the same rights and that our tribal practitioners do that are governed by tribes. And we're really close. And I've been in meetings for 2 weeks where people are telling me that new federal legislation doesn't mean what I think it means. And so sometimes these are long haul issues that you just actually can't give up on. You just have to keep writing the letter, submitting the paperwork, and letting it pile up.
Yeah. Thank you so much, Virginia. And before we close out here, I think the work that you've been doing with SACUI is so amazing. If you could tell our audience a little bit more about how we can support your work and the work of SACUI at large, that would be great.
Yeah, thank you. So you could check out the work at sacui.org, but what I really want to say is to support Redbud Resource Group. And I told you guys, I really am impressed by the work that you guys are doing. It's really phenomenal to see young Indigenous women-led nonprofit like the one that you've started during a pandemic and one of the most trying times of our country's history. And I know that you all have a website that you could link here and are also a nonprofit accepting donations. And so I really look forward to see what you all do over the next decade. I think that you're on pace to be change makers, and I'm just really excited to watch you all grow. And so I think that's where I would point folks. The work that Sakui does is very specific. We are an advocacy organization who works on behalf of 10 urban Indian organizations here in California, which includes 6 healthcare facilities, 2 access and referral, and 2 residential treatment facilities. We have a body of work around harm reduction and keeping our Indian people well, even when they choose paths that may be more dangerous than ours. We have a lot of work around COVID. We have a lot of work around domestic violence and keeping our women safe, addressing our murdered, missing, and Indigenous relatives. So Sakui does a lot of work there, and I am fortunate to lead the organization and to be in the space that I am and to share space with you all and all of you who joined us today. It's been a really great chat.
Thank you so much, Virginia, and thank you for your words and your encouragement. It has been so wonderful to work with you throughout this event, and I'm sure we will stay in contact for a very long time.
Yes.
Thank you all.
Happy birthday, Virginia.
Oh yes, also
Thank
happy
you.
birthday.
That's right. Thank you. Have a good day,
Happy
everybody.
Thank you.
Thank you all so much for coming. We posted the link to Redbud in the chat. You can follow us on Facebook and Instagram, and we'll be having more events like this moving forward. Thank you all so much for being here.
Bye.
Bye, everyone.